Hi everyone, welcome to Physio Ed's Q&A webcast where we are answering your questions from our community. If you have any questions that you would like us to answer, please check us out at physioed.com. Physio Ed Connect, that is where you can sign up for free to be a part of our community, where you can be submitting your questions so we can answer them here for you guys. Just as a reminder, the answers that I'm going to be giving to these questions, they're just general education and movement strategies. These are not designed for individual diagnosis or individualized treatment. So if my questions are not answering if my answers are not answering your questions appropriately, please reach out to a local physical therapist or provider in your area. All right, so we're going to jump right into this with our first question of the day, and this one comes from Lila, and Lila is 56 years old, and they say that they have always loved gardening, but lately bending over for too long leaves them with a stiff back, and they don't want to give up tending to the flowers, so they're wondering if there are any tricks or exercises that can make gardening easier on their back. So some tips and tricks, the big thing really is going to be body mechanics. So there's a couple different things that you can do. Part of it could be just getting a cart or one of those kind of nice wide and sturdy stools that you can be sitting on for gardening. If that is still causing you to have a bending forward posture, another thing you can do is be on your hands and knees in kind of that quadruped posture where your back is in a nice straight alignment. Now that will require good strength for your arms as well as your hips, but that is a position that can be easiest on the back as long as everything else is working just fine. So I would recommend trying out either purchasing a cart, a gardening cart, or a gardening stool to be using. Some of them you can use both for kneeling and for sitting on. So you might want to check one of those out. Just make sure you get something that's nice and wide so that when you sit on it, it's not going to be all tipsy and it's not going to be turning over. So highly recommend trying to get something like that, or being in, again, that quadruped position where you're keeping your back in a nice straight alignment. So try checking those out. I do think that we actually have a couple of videos online about that. Those are part of our bone strengthening series. So please check those ones out as well. In addition to a couple of those tricks or just different motions or movements that you can be gardening in, a great little resource is an article on Physio Ed's website that is called A Guide to Sciatica Exercises. So although it seems a little funny, I'm assuming that you haven't been diagnosed with sciatica, Lila, but these exercises, there's 3 on here that are actually really good for anyone who's having some back stiffness or soreness. So the first one would be a pelvic tilt, where you're really just kind of with your pelvis just kind of tilting forward and backward. That is helping to kind of strengthen up your core muscles and loosening some things up for your low back as well. A great strengthening exercise for the back and glutes and core would be bridges, and those can help to strengthen up your postural muscles, hopefully to reduce some of that stiffness that you might be getting with bending over for that gardening. And then another simple one is a knee to chest stretch, where you're laying on your back and just giving your knee a little bit of a hug to your chest. So those are 3 exercises on that article. And again, the article is A Guide to Sciatica Exercises. Now, I understand you may not have sciatica, but those are great exercises that can be helpful in addressing your back soreness that you're getting with gardening. So please check out that article. It might be very helpful for you. And anyone who's having stiffness for their back, especially with gardening, again, trying to do the modifications either with a gardening cart or a stool to be sitting on. And if that's still not addressing the problems, or it's putting your back in a improper alignment, you could try in that hands and knees position, where it helps to keep your spine in a nice straight alignment while you're gardening. And as you're gardening, try not to get too caught up in continuing with it. Take breaks. It's okay to take breaks, to be standing up and moving around. If you're gardening for 2 hours and you're not moving your position, maybe that could be a problem for you. So it can be really nice setting a timer. If you're like me, if I get to weeding, I'm really focused on getting those out and I don't even realize how long I've been doing it for. So I try and set a little timer on my phone. Maybe that's every 15 minutes. So maybe it can be longer if your back has more strength to be able to tolerate those positions, or it it could be shorter if you're just getting back into gardening for the season. So those are some tips and tricks that you can try out, and I'm hopeful that they can be helpful for you, Lila. All right, our next question comes from Harold. Harold is 70 years old, and he is saying that he had a fall last winter while carrying groceries, and although he wasn't hurt, he was pretty scared. So now he is realizing that he's avoiding certain activities, like going downstairs to the basement that may put him at another risk of a fall. So he's wondering how to get past that fear and how to kind of rebuild trust in the body to get back into these activities that he didn't used to be so fearful of. So Harold, I talk to my patients a lot about this, that I feel pretty strongly that some of the rehab and recovery that we're doing in physical therapy, about 80 to 90% of the recovery is really mental and only 10 to 20% physical. So when people have a fall, I think that a healthy fear of a fall is okay, but if you're so fearful that you're not doing things that you could be doing, then that's a limiting factor that I think you certainly need to address. So it could be very dependent. I'm not sure why that fall happened, Harold. It could have been a slip on ice and there was nothing you could do about it, and now you're just fearful. But if there is something where you're having a weakness in your legs, or if you are having some balance problems, now again, balance problems can happen for multiple different reasons. So it would be good to kind of get yourself evaluated or check out an article on Physio Ed that specifically talks about how to test your balance at home. And if you have a problem, where you can be going or what you can be doing with that. So check out that article on Physio Ed. We might be able to link that one into the comment section. Now, specifically for the stairs, it may seem a little funny as long as everything is good with your lower extremities and you have fairly good balance. Sometimes we actually work on going backwards downstairs to the basement with patients. Part of the reason that I like to do that is because you don't see where you're going to be falling to if you were going to have a fall. And sometimes if fear is the big thing for you, not being able to see the bottom can be very helpful. And so if you've turned around and you're going backwards on the stairs with, your hand on the hand railing or on the walls on the way down, that can be actually really beneficial because you're really just taking it one step at a time and you're not looking to, an impending doom of a fall. So you might want to try that one out. Now, if you're getting back into activities you haven't done in a while, please do them with someone who is able-bodied, who can be right there with you to support you and help you with preventing a fall in that way. So balance exercises, though, can be very helpful to improve your confidence in your body. If you feel like balance is the problem, if strength is the problem, then that might be something that you need to address further, whether that is ankle strengthening, knee strengthening, or hip strengthening. So there could be multiple different ways why you are having, this fear or what you're feeling in your body. Most of the time it is either from the balance or it is from the strength in those legs. So those might be some things to kind of check out. And we'll be able to put a link in for another video that talks about going down the stairs backwards or trying to improve that. So a little bit of it, if it's just the fear that's the problem, having someone right there with you who can support you if you need it, and a little bit of exposure therapy in a way where you're doing these activities to help you build confidence and show you, I can do this thing. So those might be some things that you can be trying out. And the next question, this one is our final question coming from Frank, who is 68 years old, finally retired. Congratulations. I can't wait to be there someday. He is traveling around and wants to be more traveling with his wife, but that requires long plane rides. And so in those long plane rides, his legs can feel heavy or sore. And he's wondering if there's something he can do on the plane or even before he gets on the plane to help with the circulation and the joints feeling good on those long plane rides. Now, I have had kind of issues like this for myself as well. If I have my feet in what's called a dependent position, where my feet are, the lowest part of my body and gravity is pulling all of our fluid down into the legs while we're on these long plane rides and we're not using our muscles or to kind of get that fluid out of our feet, or if we're not able to elevate our feet, then that kind of swelling can happen in the legs and the ankles, and that can give that soreness or that heavy feeling. So something that a lot of people do is wear compression socks while they're on an airplane. That can help with the swelling and make sure that you aren't having any problems there. But something that is also recommended is while you're on these long flights to be doing some exercises. Some of that may be just getting up once an hour, once every 2 hours to go up and down the middle of the plane when you're allowed to get out of your seat. That can help with those muscles to kind of loosen some things up and help the pump and the flow to get the swelling out of your legs that might be causing some of that heavy feeling. And we're going to put a link into this video as well in the comment section for a few exercises that you can be doing in a tight space to help with that muscle pump and a little bit of the mobility. And it can be a little awkward to be doing exercises in such a close proximity to people. So it's a little bit focused. If you can get an aisle seat, or if your spouse can have that aisle seat, that'll make it a little bit less awkward for you, so that when you get out, you're not just right in somebody's face. But doing things like heel raises, that can be really good to pump up those muscles and get the fluid out and help decreasing some stiffness in your ankles. A march can be a really good thing. It works on the ankle, knee joint stiffness, and hip stiffness. So those are just 2 exercises that are pretty simple that you can do standing right there in a tight space and not feel too awkward, in addition to a couple other stretches that video will go over as well. So I hope you guys found these answers helpful for your questions. Again, please join us at Physio Ed Connect for free, where you can submit your questions so we can answer them here. Thank you guys very much for joining us today at Physio Ed, where we are helping you all stay active and healthy for a lifetime.